Hi, good morning, Ralph. My name is Mihiraa. Let's start the warm-up session. Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here, nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
Your preparation time is over. You can now start your role play.
Good morning, Mihiraa. My name is Carvin Smith, your nurse. Thank you for pressing the call button. I'm here to help you. First of all, I would like to know the reason why you called me to your bedside.
Thank you for coming, Carvin. I called because my leg is hurting a lot more than before. I thought the surgery would make it better, but the pain feels worse now. I'm really worried something is wrong.
I'm really sorry you're going through this, Mihiraa. To help you better, could you please describe your pain in detail?
The pain is right in my lower leg, around the incision area. It's about 7 out of 10. It started getting worse about an hour ago. It feels like a deep, throbbing ache, and sometimes it stabs when I move even a little.
Thank you for telling me that, Mihiraa. Now, to get a clearer picture, I also need to explore any other symptoms you might be experiencing.
Yes, my leg is swollen more than yesterday. No numbness or tingling, but I feel a bit warm all over, and I have felt a little sick to my stomach since this morning. No chills, though.
Thank you for letting me know, Mihiraa. That's very helpful. I want to reassure you that experiencing some pain around the incision site is completely normal, especially since your surgery was just yesterday. However, since the discomfort seems to be increasing, I like to take a closer look to make sure everything is healing safely. Would it be all right if I gently remove the dressing to examine your leg?
Yes, you can remove the dressing. I just want to know if everything is okay.
I completely understand your concern, Mihiraa. It is very natural to worry about infection after surgery, especially when you are in pain. Let me reassure you about this. The chance of developing an infection right now is very low. This is because your surgery was done using a sterile technique, which means everything that touched your leg was thoroughly cleaned and free from germs. In addition to that, you were given preoperative antibiotics through your vein before the operation, and those antibiotics continue to work in your body to prevent any infection from starting. Now, looking at your current condition, Mihiraa, I can confirm that there are no clear signs of infection present. You do not have a high fever, which is often one of the first signs your body is fighting an infection. I also do not see any spreading redness around your dressing, and there is no discharge or oozing coming from your wound. So, although your pain is increasing, it does not appear to be caused by an infection at this time. I want you to feel safe, so please let me know if you notice any redness spreading, any bad smell, or any fluid coming from the wound. Does that help ease your worry a little?
That makes me feel a bit better. But why is the pain increasing if it's not an infection?
That is a good question, Mihiraa. I will inform the doctor about your increasing pain. We will check your prescribed pain relief, both your regular pain medication and any breakthrough analgesia, that is, extra medication for sudden or severe pain. Before I leave, do you have any other concerns or questions you want to ask me right now?
No, just please help me with the pain and let me know what the doctor says.
I will do that, Mihiraa. Let me now summarize our whole discussion for you. You called me because of increasing pain in your lower leg, which you rated 7 out of 10, throbbing and worse since an hour ago. You also have swelling, mild warmth, and nausea, but no numbness or chills. I explained that some pain 24 hours after surgery is normal, but we need to check. You gave me consent to remove your dressing and examine your leg. My next steps are to examine your leg dressing, wound, swelling, circulation, sensation, movement, and check your vital signs. I reassured you that the infection is a very low risk, and you have no major signs of infection now. I will inform the doctor about your pain and check your pain relief options. Is there anything I have missed or anything else you want to add?
No, that's everything. Thank you, Carvin.
You are most welcome, Mihiraa. I will start your examination now.